Welcome to this week's edition of Madisyn with the News. Today we're going to be talking about the fentanyl epidemic in the United States. It is important to note that fentanyl is classified as a Schedule II controlled substance according to the Drug Enforcement Administration, meaning all drugs in this class have a high potential for abuse which may lead to severe psychological or physical dependence. Other Schedule II controlled substances include hydromorphone, methadone, mepramine, oxycodone, and fentanyl. Fentanyl is a pharmaceutical synthetic opioid, otherwise known as a man-made opioid, and was approved by the FDA for treating severe pain. According to the Center for Disease Control and Prevention, fentanyl is 50 to 100 times more potent than morphine and is the deadliest drug threat the United States has ever faced. But pharmaceutical fentanyl is not what has sent the U.S. into an epidemic. Most fentanyl-related deaths and overdoses come from illegally made fentanyl. Illegally made fentanyl is sold through drug markets because it has a similar effect to the drug heroin. Oftentimes, to make the street drug stronger, heroin and cocaine are mixed with fentanyl to increase its effects. When sold drugs like heroin or cocaine, drug consumers are unaware that it is mixed with fentanyl, which is why when people overdose and test positive for fentanyl, they are most times unaware they even took the drug. While fentanyl has been around since 1968, illegal manufacture and distribution of fentanyl began no later than 1979. This synthetic opioid has become a huge problem in America over the last 13 years because such a small amount of fentanyl can kill an individual almost instantly. For example, just 2 milligrams or 10 to 15 grains of salt of fentanyl can be fatal. Overdoses on fentanyl are nearly doubling annually according to the National Center for Drug Abuse Statistics, and it doesn't help that the use and availability of fentanyl has increased in the medical community and amongst drug users and addicts. According to the CDC, nearly 88% of opioid-involved overdose deaths involve synthetic opioids, and fentanyl overdose rates increased 1,105% from the years 2018 to 2021. Last year, the United States drug overdoses hit a record high as 109,680 people died last year from fentanyl. While some states saw a decrease in fentanyl fatalities like Maryland and West Virginia, who were highly affected by the fentanyl crisis, other states like Washington and Wyoming saw a 21% increase in fentanyl-related deaths. But the question still remains as to where the synthetic fentanyl is coming from. The Biden administration has been taking a deeper look into fentanyl trafficking and have accused 8 Chinese companies for advertising, manufacturing, and distributing the chemicals that are used to make synthetic fentanyl. According to AP News, Mexico and China are the primary sources for fentanyl and fentanyl-related substances. Fentanyl is then trafficked directly into the United States, oftentimes by drug cartels in Mexico. By now you're asking yourself the question, what is America doing about this epidemic? Well, first let's start off by saying the main reason it is so hard for the United States to tackle the opioid crisis head-on is because they lack real-time data. The last known data of fentanyl-related drug overdoses is from the year 2022, so they are always a year behind. According to NPR, without current data, it makes it difficult to target the public health response effectively. According to ABC News, the primary strategy for combating illicit opioids in the U.S. is to reduce the supply of opioids in the country and to attack the enablers of the drug trafficking organizations. According to AP News, one way the DEA and Department of Treasury plan to attack the drug enablers is by finding exactly who they are and freezing their assets. Not only will they freeze the drug enablers' assets, but they will also freeze their friends, family, and affiliates' assets for benefiting from the drug enablers' money that is costing Americans their lives. States are also creating stricter laws so the people who are affiliated with making or distributing fentanyl have higher consequences. For example, according to the National Conference of State Legislatures, in Arkansas, the state added penalties for anyone who possesses, distributes, or manufactures fentanyl that might appeal to a minor through shape, color, taste, design, or packaging. In Arkansas, this offense is now an unclassified felony and punishable by a term of life imprisonment and a $1 million fine. Other states such as Hawaii, Kansas, Arkansas, and 11 others have changed their definitions of drug paraphernalia to exclude fentanyl testing strips. The CDC now allows fentanyl testing strips to be used across communities to detect fentanyl in the substances they use. While this is not a solution that will end the drug epidemic, it will help save many Americans' lives from overdosing on fentanyl. According to the Substance Abuse and Mental Health Service Administration, communities that are heavily affected by overdoses and drug addictions are also given easy access to Nexalon, which is a medication approved by the FDA that is designed to rapidly reverse opioid overdoses. So while America may not be able to end this epidemic anytime soon, they are doing as much as they can to save Americans' lives and punish the ones who are endangering hundreds of thousands of lives each year by making and selling fentanyl. If you or anyone you know is suffering from drug addiction, please call 1-800-662-4357 to get the resources you need. And that's it for this week's edition of Madisyn with the News. I will see you here next time.